All right, so now we're going to talk about exercise and implanted devices, so pacemakers and ICDs. So in the immediate post-implantation phase, you will be advised to limit your shoulder flexion to below or at shoulder height, so you won't go above. So because you've had the battery or the device implanted here, the wires come down to your heart. You want to make sure that that space stays nice and relaxed and doesn't get stretched to make sure that the wires aren't pulled out of the heart itself. And it also allows this healing as well. So the other aspect of that is no heavy lifting. So you don't want a lot of muscle, too much muscle activity, too much intense muscle activity in the early phases while all that's recovering and healing. Usually these restrictions last for about 6 weeks, but it does depend on your treating cardiologist. So do take their advice and they'll let you know when you're ready to start reintroducing exercises. Certain activities such as golf, tennis and swimming are usually restricted for the first 6 weeks after the implantation, but then can be safely and progressively reintroduced back into your activity routine under the guidance of your cardiologist and exercise professional. So again, these are movements that involve potentially swinging back or too high up, particularly with the swimming coming up and around, or even breaststrokes comes out and around. So there's too much movement in the upper body. Even with golf, if you swing and open, again, same thing. So there's too much movement up there. So they're usually restricted at least for the first 6 weeks, but should be able to be safely reintroduced after that. And there's no reason why you can't go back to or start swimming after you've had a pacemaker or ICD implanted. The evidence suggests that it is safe and effective to do so in the right time frame. So contact sports, on the other hand, should be avoided if you have an implanted device. Any blunt trauma to the device itself can damage it, and obviously that's a pretty big issue, so we don't want that to happen. If you have an ICD, you want to make sure that you keep your heart rate at least 10 to 15 beats per minute below the threshold for therapies. So this requires an understanding of your device settings and an understanding of the reason for why you have the device in the first place. So is it for atrial versus ventricular abnormal heart rhythms? Is it a primary prevention thing, or is it a resynchronization therapy? So we spoke about third-degree heart block and being no communication between the atria and the ventricles on the bottom. So resynchronization therapy basically puts that order in sequence and says you go, pause, you fire, in that order. If you are in doubt, contact your exercise professional, aka us, and we'll be more than happy to guide you through the activity process. Exercise and physical activity should be resumed and or started after your device has been implanted. So it's quite possible that in the lead up to having the device implanted in the first place, that you've undergone quite a bit of deconditioning, or even your recovery from the heart event that led to the device being implanted. You have to start again, or start at a lower level compared to what you are now. So regular exercise can and does help with fitness, strength, and your quality of life. So it can help you to regain your confidence and your ability to do your daily tasks when prescribed and monitored appropriately. So again, a lot of this probably comes down to patients' confidence as well, but a big thing we see is having a device implanted is a big thing for you guys. And it's completely understandable. So it's nice to have someone watch you or monitor your exercise to make sure you're doing it the right way and you're progressing at an appropriate level. So that's it for devices and exercise. Hope you got something out of it.